Hello, my name is Ron McCulloch and I'm a consultant podiatric surgeon specializing in the condition of Morton's neuroma. We offer many forms of treatment at our facility, including cryosurgery, radiofrequency, open surgery, and so on. This video describes the time when perhaps the only option is open surgery, and it's useful for patients to know when maybe this is the one they should now be considering. Thankfully, we have very few patients going to open surgery in our facility because the vast majority respond to the minimally invasive treatments that we have available. So to give you some examples of when we would move to an open procedure. First one is if the neuroma exceeds around the 2 centimeter mark. The caveat to this, and it's an important one, is that we get patients every week who are told that they have 2 centimeters neuromas, but they don't. What they have is a 2 centimeter bursa neuroma complex. And if, for example, you do an MRI, often the measurement includes some of the bursitis around the neuroma and it is therefore inaccurate. Now, the question you may well ask is, well, how do we know then whether it's bursa or neuroma, and how do we differentiate? Well, there's a straightforward test during ultrasound which involves compressing the foot, which allows me to determine how much of the bursa neuroma complex, as it's often referred to, is actually a true neuroma. And I can advise that it is extremely rare for a neuroma to exceed 1 centimeter. You might well have been told that you have a neuroma that's larger than 1 centimeter, but normally when I scan it, you'll find that that's not the case. But if you do have a true 2 centimeter neuroma, then I think open surgery is probably the best option. The last 2 that I've removed actually were reported as neuromas. I was suspicious that they weren't. They were reported by the practitioners and by radiologists. And when I removed them, both turned out to be different types of lesions. So because of that, it is really very unusual to find neuromas of that size. And that's why the vast majority of patients that we see do have minimally invasive treatment for their Morton's neuroma, because if it's a true Morton's neuroma, it won't reach that size. Now, I don't think there are any particular medical conditions or situations where you would choose open surgery over a minimally invasive surgery. Open surgery is always going to have more risk of complication, much longer recovery, etc. So I don't really think that is a part of the equation. Very rarely patients don't respond to minimally invasive steroid injections, minimally invasive treatments, etc. There is a point where one has to say, okay, it is actually less traumatic to remove the neuroma surgically than it is to continue to treat it with other treatments which might actually cause more deterioration of the tissues just simply because it's been done so often. And this is particularly true of steroid injections, of course, which cause significant wastage. It's an uncommon situation, thankfully, when patients have had 10 or more minimally invasive treatments, as I have sometimes encountered, where patients have come in and had all sorts of things. Sometimes a clean, open procedure can be the best way forward. Those situations are few and far between, actually, and I would urge patients and people to contact me if they feel they're in that position so I can give them some more advice.